Hi everybody. Today we are going to be focusing on the lymphatic system, discussing the lymphatic vessels, the organs and tissues that are associated with the system. To start with, we're going to look at two of the main functions of the lymphatic vessels and to make sense of what are the functions associated with it. So if I'm looking at the two main functions of the lymphatic system, I can simplify them to one, collect leaked fluid from your from your cardiovascular system. And the second one that is basically most of you guys know as is immunity, so defense of your body. So for the first part, we're going to talk about the first function of the lymphatic system, which is collecting leaked fluid and returning them back to the cardiovascular system. And for that to happen, what you're relying on is a network of lymphatic vessels or lymphatics that are allowing that fluid to be collected. Spreading throughout these lymphatic vessels, we have tissues that are referred to as the lymph nodes, and I'll discuss that in more detail. And their job is to clean the fluid that is within the lymphatic vessels, and it's known as lymph. So you have the fluid, which is lymph. You have the vessels that are called lymphatic vessels. And to make sure that this fluid, lymph, is clean, you pass them through these nodes throughout the lymphatic vessels, referred to as lymph nodes. And again, their job is to clean your lymph before returning it back to the cardiovascular system. In addition to the vessels, we also have lymphatic organs, which are identified as your tonsils, as your spleen, as your thymus, bone marrow, and these are also can be identified as tissues depending on the complexity of the structure. And we'll discuss this in more detail again as we go through the PowerPoint. So when we're thinking about lymphatic vessels, one of the key components that you guys do need to remember is that one of the main functions of the lymphatic system, which is returning any leaked fluid, which includes plasma proteins, back to the blood. And it uses a complex networks of lymphatic vessels that are similar in a structure to what we see as far as your blood vessels. So they have similar branching, that the smaller branches are merged together to form larger branches, and larger form the largest branches. So same process this does take place in the lymphatic system as well. In average, if you want to get an idea, you basically circulate about 3 liters of the interstitial fluid, or your IF, for every day. Remember that your total blood volume is about 5.5 liters. So a good portion of that fluid is going to be leaked out and then eventually being collected by your lymphatic vessels and returned back to your cardiovascular system. Do remember that when we're talking about leakiness of the blood vessels, the leak is actually associated with your capillaries, where your gas exchange takes place. And again, this gas exchange makes it more, it makes it easier for the fluid and other components of the blood to leak out and eventually be picked up by your lymphatic vessels. Now, when we're looking at the lymphatic vessels, similar to what we described for your blood vessels, we have very, very small network of lymphatic vessels, which we refer to them as lymphatic capillaries. And then lymphatic capillaries are going to be basically merging together to form larger lymphatic vessels, which have their own category. So we're going to start by looking at the lymphatic capillaries. So what you see here in the picture on the right hand side is a network of capillaries, as well as the network of capillaries represented in red, and then it changed to blue because it goes from oxygenated to deoxygenated, and eventually gets picked by the venules. Do know that, again, the capillaries are where the leakage takes place, so when that fluid is leaked out, you want your lymphatic capillaries to be available to pick up that leaked fluid. And that's what exactly you see here in green is a very complex interlaced network of lymphatic vessels that are working very closely with your capillary network. So any leaked fluid from this gets picked up by your lymphatic vessels in green. Do note that not all organs in your body contains these lymphatic capillaries. They are absent in your bones, teeth, bone marrow, and central nervous system. So what they're relying on, they have their own system, or they don't have as much as leakage that requires the lymphatic capillaries. As far as the structure of these capillaries, they are very similar to the blood capillaries, which means they can pick up and exchange material, hence they have the ability to pick any leaked fluid. But they're considered to be more permeable compared to your regular blood capillaries. The other thing I would want you guys to notice is the fact that the lymphatic capillary are one-ended vessels. By that I mean this. If you look at your blood vessels, you start with the heart, you go through this network that goes around, and eventually return back to the heart, which means you have a cycle, right? You start with the heart, you end with the heart. The one-ended vessels imply that basically you don't have that cycle pattern, right? You have the capillaries that start from the blood capillaries, or you have, I should say, lymphatic capillaries that start from your blood capillaries, and they just move toward the heart. So it's a one direction, there is no cycle where you start with one thing and then end with the same thing. So that's one of the main differences you will observe when comparing lymphatic capillaries versus blood capillaries. Now, to ensure that the lymphatic capillaries are doing what they're supposed to do, you have a couple of specialized structures associated with them. One thing that you should notice is that you have these basically cells, cells that are making up your capillary lymphatic capillaries, which we refer to as the endothelial cells, are on top of each other. So there is an overlap between them, which creates this flap rather than cell being one cell and then another cell and there's a gap between them. This is what you see in your blood vessels. In lymphatic capillaries, on the other hand, lymphatic capillaries, what you see is you have one cell and the second cell form a flap on top of it. So let's keep that in mind. So let's say you have this flap, you have this flap. This is basically where you have your lymph flowing, and this space is your interstitial fluid. So what happens is, as the fluid gets leaked out into the interstitial fluid, there is more and more pressure because there is more fluid. Now this pressure is going to push down on this flap and is going to open the flap and allow the lymph to flow into the lymphatic vessel. Now when the flow stops, when the pressure slows down or decreases, then the flap is closed up and no more fluid comes into the lymphatic system. So anytime you have built up a fluid, flap opens, fluid flows into the lymphatic capillaries, and if the pressure in the IF is down because there is not much fluid, flap is closed and then there is no flow of lymph. The other thing that you should also notice is that because there is no pumping action in these lymphatic capillaries, basically there's going to be a significant amount of, there wouldn't be any significant pressure. So there is a tendency for these lymphatic capillaries to collapse on themselves. So to ensure that doesn't happen, what you see here is these little strings that are sitting around. These are basically act as collagen filaments collagen filaments, and their job is to anchor your capillaries to the surrounding tissue and make sure that, again, the lymphatic capillary doesn't collapse on itself and it can effectively collect the leaked fluid. Moving away from your lymphatic capillaries, you basically will be collecting that fluid to a larger lymphatic vessels, which basically would be the second in line after capillaries, and these would be referred to as the collecting lymphatic vessels. All you need to know about them is that these are collecting from the lymphatic capillaries, and then what they do is they merge each other to basically empty or drain to the larger network of vessels called the lymphatic trunks. So lymphatic capillary, collecting lymphatic vessels, and then lymphatic trunks. Do note that when that happens, you do have a relatively lower number of lymphatic trunks because these are becoming larger and larger. They are named based on the regions of the body. For instance, if they are collecting fluid from the back, we refer them to the lumbar. If they're collecting from somewhere over your shoulder, in the anterior aspect, we would be calling them subclavian. And then if you're collecting from the region around your neck, we'll be calling them the jugular lymphatic trunks. Now, after lymphatic trunks, you get to the largest category of lymphatic vessels, which are referred to as the lymphatic ducts. And there's only two major lymphatic ducts. One that is referred to as right lymphatic duct. This is the smaller one of the two. And the second one is the thoracic duct, which is the larger of the two. If you take a look at where they drain, it makes sense because right lymphatic duct only collects from your right upper arm and the right side of the head and thorax. Sorry, it should be just the right arm, not right upper arm. Right arm and right side of the head and thorax, versus the thoracic ducts will be draining from basically the rest of the body. Here is a picture that highlights what I'm trying to describe. So if you take a look at the areas that is shaded in green, which is the right side of the head, neck, thorax, and your upper your upper limb on the right hand side, that is collected into your right lymphatic duct, and if you're talking about the rest of the body, which is in a pink color, that is collected by the thoracic duct. And where they are being emptied, we are looking at the region between the jugular and the subclavian vein. So basically this is your jugular, this is your subclavian, and this is the region they basically get empty into. This is one side and this is the other side. Do understand that I can give you questions about which of the ducts would be collecting from specific regions of the body. For instance, if I say the right arm is being, the fluid leaked from the right arm is collected by, and your answer would be the right lymphatic duct. But if I say what is the right leg, where is the right leg fluid collected by, then your answer would be the thoracic duct. Next, looking at the characteristic of the lymphatic vessels, you do remember that I mentioned that there is no pump, there's no heart or anything resembling a heart. Therefore, there is no pump, therefore there is no pressure, which makes it very difficult for the lymph to find its way all the way back to the area around the heart and basically return that leaked fluid to the cardiovascular system. So how do you ensure that the lymphatic vessels are effectively circulating the fluid back into the cardiovascular system. They use the following mechanism. One is referred to as the milking action of the skeletal muscle. And simply put, that means that when your skeletal muscles are contracting, they're putting pressure on your lymphatic vessels, and it seems like they're squeezing their lymphatic vessels. Now remember, if you squeeze the vessel, some of the fluid can move up and some of the fluid move down. So to make sure that the fluid doesn't backflow, then you do what? You put valves throughout the lymphatic vessels to prevent that backflow to take place. You also can bundle some of the lymphatic vessels with their nearby arteries. So every time your heart pulsates, basically that pulsation allows the movement of the fluid as well. And lastly, the lymphatic vessels themselves have a very thin layer of a smooth muscle, and through the contraction of this smooth muscle, you're able to move the fluid back toward the heart. Do remember that the more you have physical activity, the stronger your skeletal muscle, as well as the pulsation of the artery will be, and it help with effectively moving the lymph through the lymphatic vessels. However, the more sedentary life that you have, immobilization for a long period of time causes the lymph to basically be pulled in the lower extremities, and as a result causes swelling of the tissue. So the more you move, the faster the fluid moves, the more effective you circulate your fluid and return it back to the cardiovascular system. There is a homeostatic imbalance which is called lymphedema. Basically, if you break the word, you have lymph and edema. So we know already edema means swelling. In this case, lymphedema implies that it is associated with a lack of functionality in the case of your lymphatic vessels. So this is relatively severe localized edema. This happens because of surgeries where part of the lymphatic vessels are removed from a region of the body. An example of that is breast cancer. When the breast tissue is removed using surgery, the lymphatic vessels and nodules around the area is also removed to prevent the risk of spreading the cancer to the rest of the body. Therefore, when you remove those lymphatic vessels and lymph nodes, the effective drainage from that lymph is limited, and therefore that causes a severe edema and enlargement of the respective limb. So I'm going to stop this PowerPoint and we'll continue in the next PowerPoint with the lymphatic cells and tissues and organs.